In the segment on viral hepatitis, I made the case for the essential nature of the liver and its importance as a vital bodily organ for our health and well-being. And while it may not enjoy the celebrity status of the heart of the brain, certainly it's critical for health. Think of the liver as the body's factory. When we eat, we take in food, we take in nutrients. These travel to the liver, where the liver processes it into very important constituents: cellular building blocks, hormones, enzymes, and antibodies, 24/7, 365, to keep us feeling well, to keep us healthy, and to keep our bodies functioning like they're supposed to. I also made the case in that segment for every individual taking care of their liver and avoiding liver infections, moderating alcohol. I talked a bit about medications, and that's going to be the focus today. We're going to focus on the effects of alcohol in the liver, and we're going to talk about toxic medications. There are essentially four factors, four causes for common causes for liver disease: viruses, the viral infections, the viral hepatitis; alcohol; medications; and the new kid on the block, obesity. Morbid obesity is now recognized as a factor for liver failure. When it comes to alcohol, there's both acute alcoholic hepatitis and chronic alcoholic hepatitis, which is also known as cirrhosis. In the early phase, when alcohol consumption is excessive, that's acute alcoholic hepatitis. And based on whether genetic factors, patterns of drinking, whether you're a male or a female, obesity, a past history for infections, acute alcoholic hepatitis will come on early or may require drinking over time to develop. That said, if the drinking continues once you develop alcoholic hepatitis, it goes into cirrhosis, which is a chronic form, which in and of itself does not constitute repairability on the part of the liver. So in acute alcoholic hepatitis, if you stop drinking, you can cure that condition. With chronic alcoholic hepatitis or cirrhosis, stopping drinking will not cure the cirrhosis. Well, many people would ask, how much is moderate drinking? Well, the American Institute for Alcohol Abuse levels it out in terms of standard drinks. So a 12-ounce beer is one standard drink. 5 ounces of wine is one standard drink. 1.5 ounces of distilled spirits is one standard drink. And men may drink up to 2 standard drinks per day, and women 1 standard drink per day as to be considered moderate and to be a healthy amount. So moderating alcohol consumption avoids the issue of either acute alcoholic hepatitis or chronic alcoholic hepatitis and liver failure. Let's move on to the medications. There are several medications commonly taken which are hepato or liver toxic, and you've probably taken some of them. I bet everybody in the audience has taken aspirin. Aspirin has liver toxicity. So does Tylenol, also known as acetaminophen, 2 commonly consumed drugs which are liver toxic and must be taken prudently and with caution. There are other over-the-counter medications which are liver toxic, and there are several prescription medications. Augmentin, a common antibiotic to treat infections, is liver toxic. It may be the most liver toxic of the commonly taken medications. Nitrofurantoin or macrodantin is liver toxic. It's used for urinary tract infections. Isoniazid, a drug used to treat tuberculosis, and which you need to take for 9 months, must be monitored for liver activity and liver toxicity each month during the course of the treatment. Testosterone is liver toxic, not to be prescribed willy-nilly and not to be prescribed without following carefully its impact on the liver, to include liver cancer. Vitamin A, over the counter, liver toxic. an herb called comfrey, another herb called black cohosh, kava as well, are hepato or liver toxic. So this must be used with great great care. And depending on your risk factors, if you have a past history for one of the viral hepatitis, if you have certain genetic predispositions, if you're obese, you should talk with your doctor about any medication that you take which may be toxic to your liver. This is Dr. Jim for Be Healthy, Be Happy. Look on our website for a more complete list of medications which cause damage to the liver. Take good care of your liver, power your path to happiness, and subscribe to Be Healthy, Be Happy with Dr. Jim on YouTube.